Hello, my name is Charles Roehr. I'm a neonatal consultant at the John Radcliffe Hospital in Oxford. I'm also the Chief Investigator of NeoCLEAR. NeoCLEAR stands for Neonatal Champagne Lumbar Puncture Every Time, a randomized controlled trial. The trial coordinating center is the National Perinatal Epidemiology Unit, Clinical Trials Unit of the University of Oxford. A lumbar puncture is a procedure for obtaining cerebrospinal fluid. It is usually used to test for infections of the linings of the brain and the spinal column. Meningitis is an inflammation of these structures, and by obtaining a tiny bit of cerebrospinal fluid, we can test for presence of bacterial or viral agents which cause the inflammation. Currently, up to 30,000 lumbar punctures are performed in babies and small infants in the UK per year. However, only 50 to 60% of lumbar punctures are actually successful. NeoCLEAR aims at improving the success rate of lumbar punctures in babies for better accuracy of the presence of infections and to rule out meningitis. We are looking at changing the position of the baby or the timing of stylet removal in order to obtain the clearest possible cerebrospinal fluid. All of the methods are currently used in clinical practice and have been shown to be safe even for preterm and very small babies. NeoCLEAR tries to establish which singular or combination of interventions is the best for obtaining clear cerebrospinal fluid. We're aiming to recruit 1,020 babies in hospital throughout England. Babies who are inpatients on a neonatal or postnatal ward can be included in NeoCLEAR if they are between 27 and 44 weeks of gestation. Their current weight should be above 1 kilogram and they should be well enough to be sat up. This should be the first lumbar puncture for the condition under investigation, and the parents should have given consent for the baby to take part in the trial. If a baby is identified to be eligible for the NeoCLEAR trial, the parents will be approached and will be given written information. They will be given ample time to read the information and will be given the chance to discuss all the questions with one of the study doctors or study nurses. If the parents agree to take part in the trial, they will give their written consent. The information gathered on their baby will be taken from the baby's notes and the clinical details. The baby will then be randomized using a computer program to one of the 4 procedures for the NeoCLEAR trial. The baby will be investigated either in the sitting or the lying, or with early and late stylet removal. If a second procedure is needed, it will again be done in the allocated technique. Clinicians performing the procedure of NeoCLEAR will have had sufficient training using a specialized neonatal mannequin. The study has been designed together with patient representatives and doctors to ensure that all patients are kept safe at all times. The baby would need a lumbar puncture for its routine medical care, and no additional risks are to be expected by the use of the NeoCLEAR study techniques. Babies will be monitored throughout their participation in the study by the clinical team, and any concerns will be recorded and acted on accordingly. If you have any further questions regarding NeoCLEAR, please contact the Coordinating Trial Unit at the National Perinatal Epidemiology Unit in Oxford.